Marshall, Dr. Kohli, might have seen her on 9 News, their medical expert. Also, Cherry Creek Heart in Aurora. It is your practice. You're accepting new patients, which is awesome. You do so much. So you are associate professor at Johns Hopkins University and Duke University as well. So you are really committed to finding the healthiest way. Healthiest. Can you figure out how to talk for me? That would be awesome.
Jenny.
Do it. But the healthiest ways to live your life. So it's Health Tidbits. This is a big season, especially in Colorado, for skiing. So let's talk about how some of the best practices for skiing.
Yeah, you guys skiers or?
No.
Oh, okay. Well, I'm trying to become one. But, I've been taking lessons, and one thing I realized is it's really tough on our bodies, right? And so you think about all the things that you're doing, the altitude, which of course can be dehydrating, can give you altitude sickness, the physical exertion of not just carrying all that gear, but actually learning kind of a new task and using muscles that you don't really kind of know, how to use. And then when you're out there, you're breathing faster, you're breathing heavier, so you're blowing off a lot more calories and a lot more water, so you can get dehydrated and such really easily as well. So it's a stress test on our body. And it's interesting, as a cardiologist, I actually often hear about patients having their heart attack on the ski slopes. And these are not necessarily new skiers. These are people who are even sort of used to skiing, because we know that inflammation gets triggered by the cold. We know that heart attacks can often get triggered by excess stress on the body, physical stress, but also just being at high altitude and getting dehydrated. So it's sort of the perfect storm to really set up your body for having bad outcomes if you don't do it correctly and don't prepare.
So what are some things and tips that you think that people should do? Say they're like you, like a new skier. What's something that you think is a best practice?
So I really like those heart rate monitors when you're skiing. And I think that's a good idea. So because your body's a little different every day. So even if you're somebody who skis all the time or somebody who is very active, some days it'll be a little bit harder. So really kind of keeping an eye on what your maximum heart rate is. And there's a formula to calculate what your kind of 85% age-corrected maximum is, and trying to stay below that so that you're not operating at a super high kind of cardiovascular level, but kind of more moderate. The hydration's really important. So you're out on the slopes, you're breathing really heavy, you're exercising. And some of us spend the whole day out there without taking a break to go to the restroom or anything like that. We don't realize that we should really be going every 2-3 hours. And if you haven't gone all day, that means you're not keeping up on the water intake at all. So that's really important. And then what you eat the morning of and the day of is really important too. So skipping meals is not a good idea. And also packing really power snacks. A lot of people I see on the slopes popping candy or M&Ms. These are not power
Well, there's a lot of alcoholic drinks happening, not on the slopes necessarily, but while people are at these resorts. So I can imagine that's got to go to the dehydration as well.
Very much so, because alcohol has a diuretic, which makes you urinate even more. So not only does it prevent the thirst reflex, which makes you feel thirsty and drink, the cold prevents that as well, but it makes you pee out the water that you already have. And so the combination sometimes of the dehydration and the alcohol can trigger all kinds of heart problems, fast heart rates, arrhythmias, heart attacks, as we talked about, even people feeling faint or dizzy. So, the last couple of times I've been up there, I've seen somebody kind of collapse or come close to collapse because of those types of things. So eating power snacks, trail mix and such. And then for lunch, don't reach for that greasy pizza. As much as I love a hot, greasy pizza, when you're, you've just exercised and you're like, I burned off those calories.
I'm going to treat myself right now. Yeah. I'm just going to eat half of it, though. It's okay. I don't need the whole pizza, just half.
So you want some nice lean protein, like a fish, a salmon, or, salad with the salmon on it and something like that. And I also like to say to eat warming foods. So that's the other thing we often forget when we're out in the cold all day. We think of warming foods just as foods that are hot. But it's not just necessarily foods that are hot, but also foods that generate heat inside your body. So foods with ginger, with cumin, sweet potatoes, these are all foods that kind of increase your metabolism in a way that generates heat from the inside as well.
I did not know that.
I did not know that either. From a joint perspective, because that's always been my thing, is I like my knees where they are, thank you.
Yes.
But is there a difference between, let's say, snowboarding and skiing? Is one better or worse than the other, or does it matter?
Yeah, so that's a great question. It depends a little bit on your current state, your arthritis, whether you already have it, kind of, are you in the 20s, 30s range? Are you more in the 40s, 50s, or more 60s, 70s? But certainly, if you think about it, skiing puts more stress on your knees, whereas snowboarding can put more stress on your hips because of where you're sort of sitting backwards and your lower back. So I would say you want to protect your joints, and I'm glad you brought that up, because stretching before, during, and after. I have never seen anyone stretch during, but they should. They really, really should, because what stretching does is it increases blood flow to your muscles. And it really helps wash away a lot of the things that can cause you to be sore the next day and even help to prevent injury. Because when you're constantly using that muscle and you're not kind of resting or stretching it in between, it can become deconditioned. You can have tendon injuries or muscle injuries
Nice.
as well.
This is why I stay in the lodge.
Or the hot tub.
It's warm. Oh, my goodness. Well, thank you so much, Dr. Kohli, accepting new patients for practice, Cherry Creek Heart in Aurora. And maybe just make an appointment and see if you're having some of these issues and you want to go skiing or whatever else. Maybe she can help you come up with a plan.